Thank you. I'm really excited to be here. Oh, unfortunately, how do I say this? Now, my name is Egbe Osifo-Dawodu, as he said, and I was a physician a long time ago who went to business school and very interested in systems of healthcare. But today I'm going to talk about Ebola. Now, I was wondering how many people here have heard about the outbreak in West Africa? Please, can I have a show of hands? Okay, almost everybody. How many people have been affected? Less than 1,000? Show of hands. 1,000 to 2,000? Greater than 3,000? Okay. How many people have heard about any innovation in the responses to Ebola, the outbreak of Ebola? Okay, no, not that many. That seems quite few. Well, today I want to draw your attention to an innovative response in Lagos. Lagos State is one of our clients. I mean, we didn't advise them on Ebola, so I can claim nothing. But I think it's very interesting to see how this may be useful in other settings. According to the Wall Street Journal, what is clear that hundreds of more lives could have been saved had other governments responded the way Lagos State government did. We have I'm Nigerian, or of Nigerian origin, and we have a proverb that says, when you're crying and when you're sad, you have to keep your eyes open, which is what the guys in Lagos did. So like most Americans, this is a poll conducted by the Harvard School of Public Health. 70% of Americans are actually watching the outbreak of Ebola quite closely. And this is Nigeria, about 90%, and this was just after the first, actually the outbreak in Nigeria is linked to one individual, and about 90% were aware about a week after he arrived. So until the Ebola in Lagos, it basically had been thought about basically a rural disease, and this was, just to remind you, people, usually you have to have direct person-to-person to get into contact, even though the first contact is usually zoonotic from an animal into humans and then goes with humans. This is the first time it's occurred in West Africa. In the past, since it was first recognized in 1976, basically in Central and Southern Africa. And from 1976 to 2013, I suppose more than 30 years, there had been about 1,700 cases. Since this present outbreak, we started in 2014 in March, there has been almost 4,000 cases. So just to show you the magnitude. And it appeared to have started near the border of 3 countries, Sierra Leone, Liberia, and Guinea, and that's why it probably spread in those countries first. But the first air travel case was reported when a Liberian American arrived in Nigeria with symptoms. Unfortunately, the Nigerians were not prepared. Ebola was 4 countries away. Usually in the past, infectious disease has always gone through the road borders, so they did not expect it by air. And the diagnosis was not made for 24 hours in Lagos. Since 1976, the disease hasn't changed very much. We're talking about vaccines and trials, but what has changed is that information gets outside. After the arrival in Lagos, this was a sign in South Korea that basically said, but they put it down the next day, that people from Africa were not welcome because of the Ebola virus. So people are really scared. And so people were really scared. Lagos has 15 to 20 million people, depending on who you speak. They're less than 20, Sierra Leone, Liberia, and Guinea are about 10 million people. So people were really worried. Urban area, 15 to 20 million people, 15 to 20 international flights a day, and there was a great concern in Lagos. It was the first time it had been in an urban city. It's the commercial capital, probably of Africa. It's 40% of the Nigerian GDP, which is the largest economy in Africa. But there is poor power supply, poor water, crowding, and people were very concerned. But it's also a major religious center. You have large churches, and people come from throughout the West African region to church in Nigeria. And it doesn't have a very great health system. This is the Nigerians. They didn't think the health system would be able to contain Ebola. This is one of those church services where sometimes you have 1 to 2 million people, in a church. So there was great concern about, Ebola in Lagos. Well, Lagos had a couple of things which I think internationally people had not thought about. Lagos has probably the most active governor who has been recognized both locally and internationally to have transformed Lagos. I mean, the last couple of years, Lagos is a much cleaner city, and the governor is very credible. He has political credibility for causing change. He also had a commissioner who was a public health trained physician who knew what to do, who had a lot of strong staff, and the consultant who made the diagnosis, the initial clinical diagnosis, also was very firm and sort of insisted on keeping the index case in isolation. And very unusual for Nigeria, the federal system actually worked very well with the state system. Lagos also has probably the most dynamic private sector. The largest African conglomerate, Dangote, is based in Lagos. There are several billionaires who live in Lagos. So there's a lot of innovation in IT, in media, and basically a can-do attitude. And in addition, the religious and community leaders were very willing to spread the word on Ebola. And also, this was basically an upper middle class or upper class disease. It had arrived by air, so most of the people in contact were actually quite educated and I think very concerned. One of the things I think that became particularly concerned was the response of the US to the Americans who had Ebola in Liberia. There was many Americans were worried about having those cases. So I think a lot of the elite Nigerians who usually go abroad for treatment were very concerned that if they do get Ebola, they have to be treated in country. So I think there was a very strong political will to actually do something in country, which was different from other countries where the disease had started in rural poor areas. Lagos also has a very high literacy rate, almost 90%, and a lot of people have mobile phones. I mean, probably at least 80 or 85% of Lagosians have mobile phones, and in this survey of 30 countries, Nigerians spend the most time on their mobile phones. They're also a city of survival. Every day, millions of people go out and figure out how are they going to survive. So what actually happened? They had political leadership. They believed the governor, they believed the commissioner. They immediately went out to the religious leaders. Nigerians are very religious. They went out to both the Christian religious leaders and the Muslim religious leaders. The Christians, the Catholics, for example, stopped shaking hands as a sign of peace. The Pentecostals stopped laying hands, and then the guys who attract people across the region, they actually had, the government actually encouraged them that they should try not to invite people from outside Nigeria into the services in Nigeria. And one of the most famous Nigerian pastors actually sent 40,000 bottles of holy water to Liberia. I'm not sure it worked, but as opposed to, the government had encouraged him not to encourage people to come into Nigeria, sick people to come into Nigeria. The other thing that was very interesting, the government decided to be very open on Ebola. Very unusual. Every day they tell the people how many people have Ebola, how many people have died, how many people have survived, and what was happening. And there was no isolation ward in the country. Within 4 days, the guys in Lagos State had converted a TB ward into an isolation ward, and they built a new ward within 2 weeks. The other thing was that the schools were on vacation. They extended the school vacation so they could train the students. And the reason why I mentioned the billionaires was that many of them stepped in and put in money immediately to support the government. What was also interesting was one of the billionaires actually decided to subsidize private hospitals who treat Ebola patients. So the first hospital that treated Ebola patients had to be closed down. So the owners got some money to them. The Lagos State actually trained hundreds of people within a couple of days to know how to enter a house, to talk to people who might have been exposed to Ebola. They recruited hundreds of people to handle contact tracing, barrier nursing, critical management, and infection control. What was also really interesting was that they didn't follow regular civil service rules. The civil service can be horrendous. They were paying these guys daily stipends. So as soon as you work on Ebola, you get paid that day, and they actually gave them life insurance. So they could have a steady stream of volunteers to help with contact tracing and Ebola support. They called everybody. I mean, like the airline that brought the gentleman in did not have a complete manifest. There were 18 people, they had them missing. They called embassies, they called travel agents. They were very aggressive. They had almost like 98% contact tracing in Lagos. And now, to enter almost any major commercial building in Lagos, you have to check your temperature. So what actually happened? This is the isolation center they built. They actually also did a massive public campaign in different languages, on billboards, newspapers, on the internet. This site, Ebola Facts, which we actually help support, had 600,000 website visits the first week. And I think 2 weeks ago, in August 24, they had almost 3 million people on Facebook. And basically was designed by some young guys in the private sector and really, who had responded to the call on innovation. What actually happened? They engaged people. And so what can they do to support the Ebola scourge? Oh, Nigerians are very affectionate. They love greeting each other. They decided new ways of greeting. This is the president's wife. No shaking hands. They stopped touching people, to reduce the spread of Ebola. Will this work? Not very clear. But it did control the spread of Ebola in Lagos. Today, there is only one person under isolation treatment in Lagos, and I think there are 27 people in Lagos who are still under surveillance. They're being called on a daily basis. In the meantime, if you go into Nigeria today, you get your temperature taken at the airport. If you come out, you get your temperature taken. And it's giving more time for the states to get prepared, for the schools to get prepared. I was told the other day some folks arriving through the border, the land borders also, they're checking temperatures, putting people in quarantine if necessary, because they were initially not prepared. But I think what's really important about this case was the use of innovation. It was a very difficult environment, but you had a politically credible leader, which is what you need. So the people believed him when he said Ebola was an issue. They did not think it was an issue against them or from some other country or other people to attack them. It was something the guys in Lagos had to do. He went out, he spoke, he encouraged innovation from different parts, a very wide range of folks, from the guys in the government, from the ways they paid people, from the ways they recruited people, from the private sector, the way they responded with money, and I was describing to you the incentives they provided to the private sector, to the technology. Lagos is one of the major technology hubs in Africa. They really got people, those apps were all designed locally, put on phones. And so you had a very wide range of different experts coming together to figure out how to address this major challenge, but there was also a really credible leader. The other thing that I think is important is that innovation has to be culturally appropriate and reflective of the environment. For example, Nigerians are very religious. If you look at that Ebola thing, there is something there that says, even while you're praying, you have to take action. You can't just pray alone. That's been the message. Pray, but you have to do something. But that, for example, is very important. So for example, if you tell people something without praying, they're not going to believe you. I think that's important. The second issue is, for example, in Lagos, they had a crematorium. Usually people do not cremate the dead. So they had it, I think, from last year. So with the Ebola case, they've had to cremate, they've had 7 dead people, so they've had to cremate people. So what have people done? They have cremated their people, but they're still having a burial service after the cremation because they feel the people have to be sort of buried in a traditionally appropriate way. So I think that's really sort of important. People are still very worried about Ebola. The other states are trying to pick up, and now, at least in Nigeria, Ebola is the #1, cause of fear. But I think on the whole, people are pretty optimistic. Lagos, a city of 20 million people living in very tough conditions. Well, not all 20 million, maybe 15 million. living in tough conditions, were able to control Ebola. You know, the other message in Nigeria is that Ebola is not a death sentence. Of the 19 people who had confirmed Ebola, 11 have survived. Most of the 11 have survived, and there's another one who's about to be, I understand is doing well, so that'll be 12 survival. So the message has been, bring out your sick, that Ebola is not a death sentence. And actually, I was reading today, one of the commissioners was saying you're more likely to die in a car accident than if you have Ebola. So, but that's a different story. These are the governors knocking fists because people don't shake hands anymore. What are the lessons for elsewhere? In the US, according to the Harvard School of Public Health, 39% of Americans actually believe the Ebola outbreak will spread here. And almost 70% of those believe that Ebola is easily transmitted. So I think that's why this might be an interesting story here. It appears that people who are less educated actually are more concerned about Ebola and also more concerned about getting sick about Ebola. So I really think that one of the lessons or the innovative approaches from Lagos that may be appropriate here and elsewhere is really how do you communicate with people in a way that is effective and gets to them and helps to change their behavior. So at this point, I mean, a lot of the information on Ebola is on the CDC website. I'm not sure how many people actually look at the CDC website, especially in groups that you might be really worried about, the youth or immigrants or inner city or travelers. So I think we need to think about innovative ways to hit groups that may come across people, may or may not. I think it's important to think about spreading information in other languages. There's been an Ebola case reported in Senegal, which is French-speaking. There's a direct flight from Dakar to New York. So I think there should be something in French or other languages so that people are aware in case there are any symptoms. I think it's important when you think about innovation in this kind of issues in communication that you really need to take innovation from the local stakeholders. I mean, in Nigeria, I think one of the key issues was that Ebola has come out as something that the Nigerians are very concerned about. I mean, the medical center, I mean, there's quite a lot of help from WHO, CDC, and Medecins Sans Frontières. But in Nigeria, you do not see them. You do not see any of the international people who are helping on medical centers. The front of it is completely a Nigerian response. And to a very large extent, the public awareness was. So I think it's important that innovation really needs to be responsive to the environment. The other thing that's important is strong political leadership. At times like this, credibility becomes important. If you don't have credibility, I'm not sure what you can do in the short run. But I think people tend to believe people that they have trust and credibility in. And so I think it's important to think about how you might want to reach out to populations where this might be an issue. I think balanced reporting is important. I think it's important that, I think like President Obama said yesterday, it's very unlikely there will be an outbreak in the US. It's a very strong health system. I think people need to understand that. I think it's important to note that in Senegal, so far nobody has died of Ebola. In Nigeria, it's about a third, 2/3 of people have survived. It's important for people to know that you can survive, and if you report early, whatever. And the other issue was, actually from the US perspective, a lot of US assistance goes to rural areas. Two things are happening, and I think one of the earlier speakers showed a map of Africa with more green. Because basically people are urbanizing. Many of the poor people are in urban areas, not just in the rural areas anymore. And in Nigeria, for example, 65% of the population are in urban areas. And so you the kind of assistance needs to kind of take the changing population into account. The other thing that I think is very important is technology and sort of process innovation. In Nigeria, mobile phone penetration is 80%. I think smartphone penetration is about 20-25%. So when you think of how do you get messages across, yesterday some of the young people were talking about different worlds. It's really important to look at the technology world. So thank you very much.
Thank you.
Thank you.
So fist bump, right?
Yeah.
Let me ask you one question. How has the Ebola crisis in Nigeria changed the way in which the Boko Haram instability is being dealt with? Has it united people in Nigeria? Because we understood that story to be really an example of divisions within Nigeria along religious lines.
Actually, it's not along religious lines. Nigeria is for a very long time, most of Nigerians actually ignored Boko Haram. Because for 95% of Nigerians, it did not affect them, and it was extremely far. Of recent, they've actually had a change of opinion. So I think what the Ebola has done, what the news or what people are saying is the government can actually do something if they try. So people are suggesting that the same sort of efforts and that they have used on the Ebola, that they should transfer that to Boko Haram. I mean, basically, I think what it has done is that the response to Ebola has built a lot of pride that they can actually do something right. And so the pressure is on the government is, why can't you do that with the Boko Haram?
It's a remarkable lesson, because I think government credibility has been a real problem in West Africa, and I think, in this, it might be a turning point.
I think so, but the other thing, sorry, to make very clear, was that Lagos was really a regional state.
Sure.
And the Boko Haram is really the federal responsibility.
It's way up in the north.
And a federal responsibility. And even though I did give the story about Lagos, I'm not sure the story elsewhere would have been the same. So that's because the Lagos regional governor is very credible. So, but I think the major thing across was, because so far there have been more than 20 or 30 other potential Ebola cases, and they have turned out not to be Ebola, different things. But what really I think has been of comfort is that the Nigerians have responded well. So Nigerians are telling the government, if you can respond this way against Ebola, that's having such a massive issue elsewhere, why can't you do this against Boko Haram?
Doctor, thanks so much.
Thank you.